The truth is, without estrogen, your body is running on empty. Your energy drops, mood shifts, and recovery slows down. It's your systems running in low power mode. So, how did we get here? How did one of the most vital hormones in our body become so misunderstood? Today, we're unpacking the benefits of estrogen, why it's essential for both women and men, and how balancing it can completely change how you feel. So let's get into it. Welcome back to In the Gray Area. I am Britni.
And I'm Travin.
And today we're going to talk about where exactly estrogen started to get its bad name.
Mm-hmm. Yeah, I know we've talked about that a little bit in the past, and I know it's funny when I was listening to your intro. I'm sure people assume that we're talking about just women until you kind of got to the part where it's beneficial for both men and women, and so I know we'll get there. But it goes back to the Women's Health Initiative study, and I know we did a whole episode on that. But that whole study kind of demonized hormones in general. Obviously we know they use synthetic hormones in that trial, but even the estrogen only arm, which it was synthetic estrogen, it still showed a lot of benefit if given to women, within that 10-year period after menopause. And it was, I think, only after, 10 years after menopause or women above the age 63 that it showed harm. But even before that, it still is not as bad as what people make it out to be. And that's even the synthetic version, let alone the bioidentical.
And it was still very minor. I think the crazy thing for me, and I go back to this many times, is when we were just at World Link Summit, when Dr. Rouzier was talking about how up until the late 70s, they actually were even treating breast cancer specific with estrogen.
High dose estrogen.
Yes.
And it's interesting. And again, we can talk about, big pharma's impact on that and, using, harmful toxic drugs versus, bioidentical hormones to treat some of these cancers. And of course, we all know how money driven things can be, and we can go down that rabbit hole. But, the fact is you can choose a, toxic drug that causes all of these other side effects, or, you can use bioidentical hormones to, not only prevent, but sometimes treat some of these diseases and even cancers, and, without any sort of side effects and other, benefits to just how you feel. Because a lot of times when people are sick and they're going through things like that, they're already feeling sick anyways, and they're not doing well. And you add on these toxic medications that are causing more harm versus using estradiol actually makes people feel better while they're being treated for some of these illnesses.
Yeah, and it is really neat to see some doctors are actually recognizing that as well. It's been 50 some odd years now. But when I just went to the oncologist with one of our breast cancer patients, it was really cool to hear him actually take the time to look into the studies and also recognize he's the quality of life that these women go through specifically with breast cancer is horrible.
Yeah, well, and he even also acknowledged that they get, pretty much no training in hormones, right? Let alone bioidentical hormones in medical school. And so, we all know that. And so you do have to kind of seek out, just like any sort of specialist. You're going to seek out further education and keep learning and keeping up on the science, because a lot of these, if you talk to a lot of people in the medical field, they'll often say that what's being taught in medical school is often 20 years behind what the current science says. And so you're already coming out kind of behind the 8 ball. And so if you're not taking it upon yourself to stay updated on the current studies and literature and stuff, you aren't going to understand a lot of these things.
Well, especially when they only get I think he said it was 5 hours.
Yeah.
And
yeah,
it wasn't
a half
about
day.
Yeah. So they don't know very much. And he was actually embarrassed about it,
Yeah.
but it's not his fault, but yet people should be learning more.
Yeah, well, and it's good that, and you're right, it's not his fault, but also, I think it's important for people to understand when they aren't a specialist or maybe an expert on something, that it's okay. And in fact, it's good for the patient to refer them to someone that is, right?
Yeah.
And instead of trying to just manage everything yourselves. And I know that there's a lot of ego that gets involved sometimes, but it's look, everyone can work together, and certain people can, trust
Help
specific providers with certain things that they're more specialized in.
Yeah. One of the other things that I always worry about, because I have it in my family, is Alzheimer's.
Yeah.
And recently I was reading something on estrogen, and it called it the cozy blanket for the brain. And that has really stuck with me, because that's something that I've always been worried about, as you know, adding in different things. But
yeah, that's one of the disease states that that starts to rapidly progress after menopause. The same with cardiovascular disease, osteoporosis, all these things that are tied back to the loss of estrogen and the increase in disease risk. Alzheimer's is a big one. Estradiol is super it is a neurological hormone, right? And it does provide a lot of like feel good benefits on mood and well-being and things like that for both men and women.
And I don't think that people really know that. I think a lot of times they think of like breasts as like what comes to mind with estrogen.
Yeah. We're getting gyno for the guys.
Yes, exactly. Maybe you could explain a little bit more onto like, because we hear that a lot. We hear guys that like when they get on testosterone, they all of a sudden they're like, well, where's my estrogen at? And am I going to get man boobs?
Yeah, it's such a huge myth. It's been like it really just needs to, like, people just need to accept the fact that like your estradiol levels do not cause gyno, right? And when we say like estrogen, we always talk about estradiol. So like sometimes I know we'll kind of interchange those two, but like just for people listening, like we mean estradiol when we say estrogen. But you know, it's interesting if you look at actual like studies, right? And let's say like androgen deprivation studies for men with prostate cancer, and they give them high dose estradiol, and we're talking about like levels of like 400, 500, 600, you know, blood levels of estradiol, and these men aren't getting man boobs. They're not getting gynecomastia. They're not becoming sensitive and emotional and, you know, crying at movies and like all these things that guys will associate with, you know, my estrogen's too high. And a lot of it comes from like the gym bros and the bodybuilding worlds. And, you know, we talk about this all the time, but there is no evidence at all to support that occurs whatsoever. And so it's like, you know,
they're also doing different things though than what we're doing.
That community, like the bodybuilding community, but just in terms of like your average guy that's on testosterone therapy, you know, you're not going to get side effects from high estrogen. In fact, you're going to get benefits, and it's shown over and over and over in every study that there's nothing but improved outcomes when we raise estradiol levels. And I think it's crazy that the like overwhelming medical community and all these medical providers like do not understand the difference between what happens at baseline is totally different than what occurs when you give something. And so they extrapolate all these studies that have, you know, men with high estrogen levels at baseline and all of these disease states. And it's totally different that when you actually give them the hormone and you see improved outcomes, right? And so just to kind of like expand on that a little bit, we know that like if you have a lot of body fat, if you have a lot of visceral fat, it produces high levels of estrone. It converts upstream to estradiol. And estradiol is kind of just an innocent bystander with the disease state, but it's not what's causing everything.
Yeah, I think that was a great way of explaining it. I think it gets confused a lot.
Yeah.
Another thing I think, like when it comes to cardiovascular benefits and stuff, you know, a lot of times we'll get women that reach out. I see this a lot where they're like, oh, do you guys offer the estradiol patch and stuff? So I have to explain to them why we personally do not, and why the better option is taking it orally, and explaining like the cardiovascular benefits for that as well. And then a lot of times they'll talk about even, okay, well, if I'm not taking a cream, then am I going to get the benefits for vaginal atrophy and dryness and stuff like that?
Yeah. Yeah, no, you get that from testosterone.
Exactly.
Right? So, I mean, that's how you treat that. But no, you're absolutely right. And there's, you know, look, if there's nothing wrong, like if you want to take estradiol transdermally, okay, that's fine. You're going to get good levels, but you're going to miss out on this cardiovascular protection that you get from the fatty acid esters that are produced from the first pass metabolism through oral estradiol.
Yeah, a lot of people aren't aware of that too.
No, not at all. And it's you know, the kind of like misunderstanding again comes from the oral estrogen, the synthetic estrogen that was showing harm from first pass metabolism. But people need to understand that like that synthetic estrogen is metabolized completely different than a bioidentical estradiol. And so you actually want those metabolites from the estradiol. And so that's what's giving some of the extra, you know, that's what's going to help reverse your like apolipoprotein B, your lipoprotein A, right? It's going to increase your apolipoprotein A. And so it's just like, you get all these benefits that you're not going to get with the transdermal.
And those benefits are things that we're told by general practitioners that it's impossible.
Yeah.
Like there's nothing.
It's impossible because there's no drug available yet to reduce those things.
So another really cool thing is I found a chiropractor in town, and I went to see him for the first time, and I've always loved going to chiropractors, but he does things so much different than what I'm used to. So going to him and getting the x-rays done and stuff like that, and then talking about it. And it was really cool that he even brought in hormones and was relating things like with the spine and how every time he sees a spine a certain way on a female, they usually have PCOS,
Yeah.
talking about digestive issues and stuff like that, and the importance of estradiol with bone density.
Yeah. Yeah. Well, our bodies, they work so efficient. Everything works when everything's functioning properly, right? It's working the way it's supposed to. And like all of these things are so interconnected. And as obviously we talk about the impact that hormones play on everything all the time. But yeah, like I'm sure he deals with that. He sees that firsthand a lot, with the whole, people being, osteoporosis and things like that.
Yeah, it was actually really cool though, because he brought me in because my older daughter had her x-rays done, and he didn't even know her hormone history. And he was looking at it and he was explaining things. He's like, yeah, anytime I see like the lower spine off like this, and then he was showing me like her digestive system and stuff. He's like, that clearly is PCOS. And so I told him, I'm like, she has PCOS. We're treating her and stuff. So he was able to actually have a really good conversation with her about it as well.
That's pretty cool. Yeah. Cause it's better when it's not just coming from mom.
Yeah.
Sometimes.
Yes. That, and it's really cool to hear it from different peoples and, and different like lines of the industry. That's not
his main field.
Yeah.
But for sure.
But yeah, so that was really cool to hear.
Yeah.
Going back for a second, we talked about like heart health and everything. Yeah. I think one thing that also is like people are so scared, men especially, they are wanting to know their number and stuff like that. Yeah. But really, like we want a man's level of estradiol just as high as a woman's.
Yeah. I mean, as a guy, you do want a really robust estradiol level. And again, like men only produce estradiol through the aromatization of testosterone. And so we have to bring our testosterone levels high enough, again, to get those healthy levels of estradiol. And I say this all the time. And it's like, people are so afraid of
a number,
right? And it's like, they don't understand that it's like, look, these benefits you're getting from testosterone, like are linear with the dose. Like the higher the dose, the better the response, the more benefit that you're going to get. If you just raise levels a little bit, you're just going to benefit a little bit. And it's like somewhere along the line, like there just became such a fear of like having such a high number. But like when you look at the studies, it's like, it's pretty, the dose response is pretty linear.
Well, I think a lot of people don't understand too, when they go to clinics, people aren't talking about like SHBG and understanding that the higher that is, the more that's going to get bound. So those levels need to be higher in order to have those benefits.
Yeah. Yeah. It's just a shame too, because it's like guys are going to these places to improve their health. Obviously, I mean, that's the main goal. And a lot of times it's just like so counterproductive of, especially if they're giving you like an AI with your, an estrogen blocker with your testosterone. It's like you're missing half the benefits of testosterone, but you're also like causing harm down the long term.
When it comes to menopause, a lot of times people don't understand that estrogen is the last hormone we lose and stuff, but it plays a huge role when it comes to like hair, skin, and nails too. Yeah. We talk a lot about the thyroid and stuff, but I mean, when it comes to collagen and tissue repair, estrogen plays a huge part to that for both men and women. But I feel like for women, especially when they start going through that, you see like a huge aging process at that point.
Yeah, that's totally true. And it's like you're right, they all play a part, but I mean, I think it's there is so many benefits to having a healthy estradiol level that people just it's like they're so scared of it, just like with testosterone. But it's like, again, I all my hormones, I mean, I want them as optimal as possible.
Yeah, and I just feel like we just keep on like we're fighting a fight that we're just like keep on like battling with people. Yeah. And it's like you can drill it in over and over and over, but they keep on going back, like back to Google, back to their friends, back to their general practitioner.
Yeah. And I love people trying to educate themselves, but it's hard. It's like a catch-22 because there's so much bad information out there. And as you know, like when people are desperate or when they don't feel good and they're just like clinging, like everything makes sense. It's, you know what I mean? Sometimes it's like when you feel bad and it's like you stumble across someone that's like telling you, oh, this is the reason why, or if you do this, it's going to fix that. And it's like, you cling on to that so hard. And it's like, it can be completely opposite of what's actually true, but it like gets in these people's heads. And it's like, it's so hard to kind of like convince them out of that.
Yeah. That's why we're always talking about like trusting who you work with and making sure that you go all in with them before you even start.
Yeah. But it's like, oh, but some stranger on Instagram said this.
Yeah.
So I'm going to believe them.
Yeah. That's a hard one. I feel like pretty thankful, like with most all of our females, especially like with the estradiol, it's been a lot easier than overcoming some of the stuff with thyroid. I think that's been a lot harder for us. Yeah.
Yeah. And even with same thing with the men too. Like I don't have to have that conversation a lot, with them. And I know that well,
once you explain even the ED issues,
that's it.
That's like,
Yeah, that's it. That's the first thing when I tell them. It's like, okay, yeah, we can, look, we'll give you an aromatase inhibitor. And then, once you get erectile dysfunction, that's the dose that you need to stay on.
Yeah.
Because that means it's working. I go, what? Like, yeah, that's going to be the main thing that you get. But
yeah, because I think a lot of times too with estrogen for females, we think of more of like losing, the vaginal dryness, the atrophy, all that kind of stuff. But a lot of people don't hear about like with men and losing it. And taking the AIs, and we hear it a lot. We get a lot of people from like these cookie cutter places that pop in, and they've got them on that and other things, and and they're miserable.
Yeah, I mean, my estradiol level is very high, and like the whole like sexual function, libido, like all that stuff is like very optimal. And it's like the opposite of what people think. Like, it's not like you don't want to keep your estradiol low. Like, you want it as high as possible, and it's going to give you like so many benefits.
But I think that both men and women, maybe even women more so, are scared of numbers. Maybe men with the estradiol and stuff, but women, like I think a lot of times when we hear women say that like they aren't getting their libido, they're scared of their testosterone levels.
Yeah.
And so that's something that we need to overcome too, because when it comes to lubrication and it comes to, atrophy and everything like, because we have a lot of women that come in and they're like, it's dry and it's painful, and getting them to like go over that limit when they see like their testosterone levels even get into like the 200s, they're scared.
Yeah.
And, after we do our follow-up labs, everything's red.
Yeah.
Because everything before was normal.
Yeah.
So we expect everything to be in the red, and that's what we want. But it's okay to keep going and titrating up if you're not getting the symptom relief that you should be getting.
It's crazy because in pretty much every other like aspect of medicine, like that's how it works, right? You increase the dose until you get the desired result that you need, right? But it's like when it comes to hormones, it's like people get so stuck on these numbers and like wanting the number to dictate, therapy. And it's like, if it were like, if I had it my way, like I wouldn't even like, I wish we wouldn't even test follow-up hormone numbers in people, because it's like, it doesn't, except for, like
we do
estrogen and progesterone with women, like you do need to make sure that certain levels are reached and maintained. But, for the most part, like testosterone, thyroid, things like that, like we're giving you the hormone, like we know the number is going to rise. Like that's an expected outcome. So like measuring it doesn't really do a whole lot in terms of like, how are we going to proceed with the therapy? Like we know it's going to raise, that's fine. But we're more interested in like how you feel and what other like health markers are improving, right? Are we like improving the lipids? Are we improving like your waist circumference? Are we improving your mood, like your well-being, like all the things that we're looking for? Like that's how we're guiding our therapy. But patients want to see the numbers because, they're getting hormone therapy and you're curious and they want to know what it is. But sometimes it causes more harm than good because they get it in their head, they see it and it's red and they get scared and it causes problems.
Although we did have like a new female patient that reached out and she's like, could you send me like the levels that she wants me to be at my follow-up? And I was like, oh no, here we go. Just because it's like everyone's different and trying to get everybody to understand that sometimes is really hard. So where I feel good at, which I've been doing it for years, is going to look different than where someone new that's just introducing these hormones into their body is going to feel good at. And it's going to change. We're going to have to make changes. And over time, yes, you can plateau and we can just, especially with testosterone and stuff like that.
I think people, I wish I wish like everyone would just understand that like with testosterone and thyroid, there is no number we're trying to achieve at all. Like it doesn't matter. We are trying to resolve symptoms, improve outcomes.
But I was listening to another provider today that was like, there is never an emergency with your hormones. And I think that people really need to understand that like everything that we're doing with bioidentical hormones is not scary.
No.
There's not risk. It's like, yes, when it comes to our women in menopause, when we're giving them estradiol, we need to make sure they have adequate amounts of progesterone. That is super important. But everything else, it's like we can, like our team is trained to make those little minor titrations up or down. Like the adjustments can be made very easily. I recently had a female patient too talk about, she thought her progesterone was causing some issue. And it's like, okay, well, progesterone doesn't cause that. And she's like, well, I Googled it. And that's hard too. Like when you're Googling things, you're going to get things, I mean, you can find whatever you want, but it's going off of progestins, not progesterone. It's like, it's looking at like synthetic estrogen, not bioidentical estradiol. So it makes it really challenging.
It does. I even so I play around with like my chat GPT all the time. And I'm always like for fun, like asking it questions and like trying to get it to go certain places. And it's like when you ask it to look at like evidence-based outcomes, like a lot of times it doesn't understand the difference between synthetic and bioidentical hormones. And especially because a lot of even studies will interchange the two. Like a lot of studies will say progesterone when they're actually using a synthetic progestin, and same thing with like estrogens. And so like when the AI or like Google is doing its searches and it's looking at these studies, like it's not accounting for those differences. And so like the information you're getting back is oftentimes like the patient is based on these synthetic hormones and the problems they cause. And then they extrapolate that to being the same as what they're taking. And so they should be getting the same problems.
Yeah, absolutely. I think this has all been really, really great information. A lot of questions that we hear all the time with estradiol and just constantly trying to combat. But overall, I think we agree, and we've seen the proof. Like there's tons and tons of studies, which if anybody ever is curious, they are always like happy to reach out to us, and we can help them with that too. Yeah. But is there anything else you want to add?
No, that's great.
I know, I agree. Yeah. All right. Well, I want to thank everybody for joining us today. Like always, please like, share, comment, and subscribe, and we will see you next time. Thank you.